It's 9 a.m. on the dot. Thank you for making time to join me here on the AM show. I'm Bernice Abubedo-Lansa. Earlier, you saw my colleague Benjamin Akapo. Now, we've been bringing you stories, particularly in the past 2 weeks, about poisoning in our water bodies. It's now time to talk to you about a group of people who are trying to change the narrative. It's the Pure Earth Blacksmith Initiative. And this morning I've been joined by Esmond Wisdom Kwanzaa. He's Country Director for Pure Earth Blacksmith Initiative. Good morning to you, Esmond. It's such an exciting moment for me because we've had this conversation before. Right. I had you here with a colleague of yours.
Right.
And recently I was watching a clip on lead poisoning in children, and then I remembered the conversation we had. But thank you so much for the work you've been doing so far in Ghana.
Right.
And this is important and timely, like I said, because of what we've been doing recently about poisoning in our water bodies. We found lead, we found chromium, we found arsenic, and it's getting worse by the day. But tell us about Pure Earth, what you've been doing so far, and how you hope to change the narrative.
Right. Thank you very much, Bernice, and it's a great honor to be here. And I would like to thank Multimedia. I think they've been partnering with us in the journey of raising awareness on lead pollution and poisoning, especially in the low to middle income countries. So Pure Earth has been partnering with civil society organizations and government organizations. We've been working with the EPA, Ghana Health Service. We had a project that just ended. I think that project was creating Protecting Every Child Potentials. That project sought to ascertain the blood lead level in children under 5 years in 3 ecological zones: Greater Accra, Ashanti region, and then the Northern region. I'm happy to say that the result of that study is out. What we've seen is a bit concerning. 53.5% of those children that were assessed in these areas have blood lead levels more than the recommended threshold by World Health Organization, WHO, 5 microgram per deciliter. And I think the body doesn't need lead at all. And so if there is that quantity in it, then there's a bit of concern. We've also done a study to ascertain the source contamination, what is actually causing the elevated blood lead level in children.
Right.
And we discovered that most of these areas, the soil contamination of lead is high. So we're talking about the industrial enclave of Afienya and Porg in particular, for example. Those areas have the highest levels of blood lead levels in children and require an urgent attention for us to educate the people there and provide some sort of treatment for the affected children that probably had recorded over 45 microgram per deciliter. That's very high. That's the level at which World Health is asking for treatment. We call it the Chelician treatment for those children. In terms of the Northern region, I think one thing that also came out from the home-based assessment study is the use of this traditional eyeliner that people call chilo. Some call it kaji kaji.
Aha.
Yeah, the 90% of the mothers surveyed in the Yendi and Tolong district actually applied this on the eyes of the children. And this lead actually measured about 1 million part per million. That means that it's technically pure lead that has been applied on the eyes of these children.
To do that for the babies.
For the babies. And so what we discovered there is that the blood lead level measurement in those 2 districts range between 75% to 80%. And so it's a bit of concern. I think one other area is the metallic cookware, especially those that are made from the scraps. Where 77% of those cookwares actually recorded lead concentrations above the recommended threshold.
So as you're cooking with them and eating, you're ingesting the lead?
Exactly. There's that possibility of that happening.
Right. So, I mean, we'll come back to talk about the impact of this, especially on children, because that's your focus. But let's talk about the International Lead Poisoning Prevention Week. Tell us about it and tell us what the main theme is for this year.
Right. So the International Lead Poisoning Prevention Week, this is a series of its kind. that has been instituted by World Health Organization in conjunction with civil society organization. I mean, the idea is to raise awareness about lead exposure and its harmful effects on the population. This year's theme is End Childhood Lead Poisoning. One thing that I must say, Bernice, is that the children's bodies absorb lead 4 to 5 times of that of adults.
Okay.
And so the idea is to raise awareness about childhood lead poisoning and also draw attention to what is being done to resolve the issues, and also to call for more action to address this issue. If not, we're risking a generation that probably might lose their IQs and may not be as productive.
Okay.
The economic toll is also huge as a result of that.
Right. So that's one of the devastating effects of exposure to lead, is that the children lose their abilities, cognitive abilities, and then it affects how they study in school and how they even appreciate, complex things. And in other parts of the world, their counterparts are moving at a fast speed. Unfortunately, we're seeing that this is more endemic in developing countries.
Exactly.
Well, we need to quickly wrap up our conversation shortly, but because this is such a broad subject matter, and I know that there are a lot of parents and, caregivers for children, teachers, institutions that need to really understand what this is all about and how to prevent the children from getting poisoned by lead. Just tell us how we can access the documents and all the material that we need. How do we get in touch with Pure Earth, for example, if we want to have a sit down for you to explain to us, basically what this is all about? Yeah.
Right. So we have a website called leadpollution.org. You can have all the information you want to know about the situation of lead pollution and poisoning. We also have our website, pureearth.org. You have pureearth.org. You have all the information on that platform that would provide all the necessary education. We've also have some recent reports published. The Rapid Market Screening Project, for example, that assess consumer goods in 25 countries, including Ghana, and the outcome of that. A lot of work needs to be done anyway. And so, we are in Ghana to partner organizations to address this situation. So far, we've seen so much determination by EPA, and I must commend EPA. Honorable Kokofu has shown the leadership coming from the findings of the PECP project and what he's doing with us to try to address the issues. We are also collaborating with Ghana Health Service. Clearly, we need to strengthen the health system around lead poisoning so that it can be diagnosed early, detected and treated. I think a lot needs to be done, but I think a journey of 1,000 miles start with a day.
Definitely.
And so I think we're making progress. I think there's been some general concerns I need to clarify. I think from the Rapid Market Screening Project, we realized that the metallic cookware, for example, the aluminum ones, 55% of those tested exceeded the threshold. And I think a lot of people were quite very worried and concerned.
But that is also the responsibility of those who are supposed to monitor what's on the market, right? So this involves policymakers, this involves market surveillance and ensuring that all these things are there. But briefly, we're wrapping up in a minute. I'd just like for you to share with us what the events are for the International Lead Poisoning Prevention Week and how we can all be a part of it.
Right, great. So I think we started by issuing a press statement on Monday. That is also on our social media handles that you can actually access. We share with the media houses as well. Yesterday, we joined UNICEF to conduct a symposium for a group of school children at the British Council. On Friday, we're engaging students at Tema Parent, where we expect Ghana Health Service, UNICEF, to join us there to make a statement to call for action to address this issue of lead poisoning. So I'm calling on all like-minded people. Of course, multimedia has always been part of us to be there and cover the event.
Thank you so much, Esmond, and we are very happy and grateful for the work you do for Ghanaian children.
Thank you.
And we wish you all the best. And that is Esmond Wisdom Kwanzaa. He is Country Director for Pure Earth, a blacksmith initiative, and they are raising awareness about lead poisoning in Ghana, and they also want you to be a part of that. So don't forget, you can reach Esmond and his team on their website, and I'll quickly run you through that. It's yourearth.org, and then also if you want to learn more about lead pollution, is leadpollution.org, and you can find all the details about lead poisoning, the impact on children, and why we all need to take it seriously. Once again, Esmond, thank you so much.
Thank you very
for
much.
what you're doing to
Thank
help
you for having
Ghanaian
us.
children. When we come back, I'll be speaking to sponsors of the NSMQ, and much later, I'll be sharing insights on the Adum Praise. Do stay.
Thank you.